Knowledge about hypertension. Diabetes. Find out in Sugar Beat, the Gets Pharma Philippines cardiometabolic social media platform. Knowledge about hypertension. Diabetes. Find out in Sugar Beat, the Gets Pharma Philippines cardiometabolic social media platform. Knowledge about hypertension. Diabetes. Find out in Sugar Beat, the Gets Pharma Philippines cardiometabolic social media platform. Hello and good afternoon, ladies and gentlemen. Welcome to Sugar Beat. Sugar Beat is the official social media platform of Gets Pharma Philippines cardiometabolic line. Sugar Beat aims to provide relevant and timely information on the prevention and management of diabetes and high blood pressure. All the page contents are designed for every Filipino to embrace the value of wellness and self-care. Previously on Sugar Beat. Last time, our guest speaker has thoroughly discussed another topic that pertains to diabetes and hypertension. This gives us clarity on how we can face and manage this specific topic and condition. To watch the replay, you may visit the Sugar Beat PH social media platforms. You can find us on Facebook, Instagram, and YouTube. On today's Monday Night Live, our speaker will share some invaluable knowledge to help us know our boundaries whenever searching for answers on the internet. To begin, please meet our speaker. Our speaker finished his medicine at the School of Medicine, St. Louis University, Baguio City. A primary care physician and a mental health advocate. A young social media influencer and currently the #1 TikTok educational content creator. To give us a lecture about Dr. Google versus medical doctors, avoiding online misconception about diabetes and hypertension, please welcome, Dr. Winston's Kilimanjaro Tiwa Ken.
Hello, everyone. Good afternoon. What's up, Kilikilis? What's up, Sugar Beaters? Yun ba yung tawag doon? Anyway, I'm so glad to be back here and delivering a lecture for you guys and answering some of your questions. And ayun, sana madami kayong natutunan sa previous lecture ko nung Friday. If hindi nyo pa napapanood yun, just click on Sugar Beat PH here on Facebook and check nyo yung video doon. Ayan, madaming mga insights doon about mga misconceptions when it comes to the treatment of hypertension and diabetes. Madami kasing sinasabi, di ba, na mga pagkain na pwedeng gamitin as gamot, pero not all are true. Ayan. And madaming mga follow-up questions and other questions din about, self-medication, pag-google ng sakit mo, as well as yung mga kung ano ba ang limitations ng teleconsult. So tignan natin yung iba't ibang questions na to. Ayan, ang first question natin is, dahil napaka-accessible ng impormasyon sa internet, ano dapat lamang ang kailangang hanapin o malaman sa Google tungkol sa sakit when it comes to hypertension? Sa treatment part, meaning totally i-disregard na ba siya? Okay, when you are Googling about your disease, it's important naman na ikaw bilang pasyente, dapat naiintindihan mo talaga yung sakit mo eh. Para alam mo kung ano ang dapat iwasan, ano ang dapat gawin para mag-improve ka. Kasi the better talaga na naiintindihan mo yung sakit mo, the more na bibigyan mo ng halaga yung pag-aalaga sa sarili. When it comes to treatment, mahirap kasi pagdating sa mga kondisyon tulad ng hypertension, diabetes, itong mga chronic diseases natin, may certain type of regimen per patient kasi. So for example, bakit pag nagka-fever tayo, okay lang naman na paracetamol, 'di ba? Pag anong gagamitin natin pag nilalagnat? Oh, biogesic, yung mga iba't ibang gamot na ganon, 'di ba? And yung mga ganon kasi, okay lang na mag-self-medicate ka with paracetamol, yung mga cough medicine, kasi hindi siya a serious illness that needs to be tailored to your patient profile. Okay, so pag nagbibigay kasi kami ng gamot sa mga pasyente, kino-consider namin lahat. So the age, the sex, and the comorbidities. Naalala ko, meron yung isang pasyente, sinabi niya, Doc, okay lang ba na magpalit ako ng gamot to amlodipine? Kasi yun yung gamit ng kaibigan ko and mas effective daw yun kumpara sa tinetake ko. Yung pasyente na yun, nagtitake siya ng losartan. And sabi ko sa kanya, no, if that is what your doctor gave to you, kasi she already saw a doctor, tapos sinasabi niya sa akin na palitan ko daw yung gamot niya. No, if that is what your doctor gave to you, yan yung binigay ng doctor mo, kasi yan yung para sa'yo. And pag magte-take ng amlodipine, may iba't ibang factors pa na kino-consider diyan kasi although effective 'yan para sa kaibigan mo, baka 'yan yung pwede sa kaibigan mo at hindi pwede sa yung amlodipine. Kasi when kaya nag-o-order kami ng labs bago kami magbigay ng gamot. And minsan pag bumalik yung labs and may problema pala sa liver mo, may problema pala sa kidney mo, we have to change your medication altogether. So yun, for example, yung amlodipine, no, it's not for all patients. If you have history of heart failure, history of kidney failure, liver failure, and if you're pregnant, hindi pwede yung amlodipine sa'yo. So you cannot rely on Dr. Google to decide kung ano ang gamot na para sa'yo kasi hindi ka naman nakikilala ni Google. Yung mga doctors nyo, nakikilala nila kayo. Nag-order sila ng labs. Nakikita nila yung measurement ng blood pressure nyo. And we give your medication according to how we know you as the patient. Eh si Google, hindi ka naman niya kilala kasi hindi ka niya nai-interview. So hindi niya alam kung ano ba ang dapat na gamot sa'yo. Is it losartan ba ang para sa'yo? Amlodipine ba ang para sa'yo? Or captopril ang para sa'yo? Hindi niya alam kasi hindi niya alam ang patient profile mo. Tignan naman natin yung next na question. Sa usapang internet, dahil sa takot na magka-COVID, ang telemedicine ba ay mainam na alternatibo? Ano bang pagkakaiba nito sa face-to-face? Yes, telemedicine is becoming, well, mas kilala na siya ngayon. Madami ng into telemedicine, madami ring doctors offering telemedicine kasi mahirap na talaga ngayon na ma-expose given our situation. Understandable naman talaga, pero pag emergency, like for example, pag emergency case talaga, for example, stroke, ongoing stroke, syempre, hindi na pwedeng telemedicine yan. For example, nasugat ka, tuloy-tuloy yung pagdurugo mo. You have to go to the emergency room. So if your case is mild and manageable naman from a distance, okay lang, sige go, let's go with telemedicine. Kasi the number one difference talaga ng telemedicine sa face-to-face consultation is the physical examination. Yun yung pinaka-restriction namin pagdating sa telemedicine. Kasi for example, inuubo. Hindi naman namin maririnig yung baga kung may plema ba doon or wala. For example, sumasakit po yung dibdib ko, ano pong pwede kong gawin? Di naman namin mapapakinggan yung puso kung paano ba yung pagtibok nito. So there are limitations talaga when it comes to telemedicine. So what we do there is nag-order kami ng laboratories and pinapabalik na lang yung patient para makita kung ano yung lab values nila, and then we treat based on the patient's history and the laboratory. So together we combine them since wala talagang physical examination. And then meron yung iba, we ask them to send, for example, masakit daw yung lalamunan nila pag lumulunok. Kaya pinapapicture namin sa kanila yung bibig nila para makita kung inflamed ba yung tonsils, kung may nana sa tonsils. And based on that, we can already give treatment, no? We can give antibiotics and stuff like that. And also mabilis na lang yung follow-up kasi they can contact you via email na lang. Isesend na lang ulit yung picture ng lalamunan nila para makita kung nag-improve na ba sila, kung kailangang i-extend yung antibiotics or pwede nang i-stop. So may mga advantages naman sa telemedicine kasi very fast transaction na siya. Hindi mo na kailangang pumila na mahaba and be exposed to the crowd, 'di ba? Lesser na yung chances mo of getting sick with COVID or being exposed to any other infectious disease. So may advantages naman ang telemedicine, and especially para sa mga seniors, 'di ba, who struggle to walk. 'Di ba? Telemedicine is a good alternative naman. We do offer the best service that we can based on your history, based on what we can see, and based on your reports, no, sa mga relatives, kung ano napapansin nila sa patient. It's a good follow-up din na platform. So although there are limitations, we can still treat naman to the best, and we still follow the same guidelines pa rin naman. We still give the same treatment for the patients with telemedicine. Hindi naman porque telemedicine iba na yung treatment namin. It's the same thing. Bakit hindi na-advertise sa mga social media ang mga gamot na nirereseta ng doktor katulad ng mga over-the-counter products na ang tanging paalala o sinasabi palagi ay no approved therapeutic claims? Okay. Now, when it comes to prescription medications, hindi talaga siya pwedeng i-advertise on television or on different social media platforms. Number one, it's because yung mga gamot na to are prescription medication. So kahit na i-advertise ng mga celebrities, hindi naman makukuha ng lahat ng tao kasi kailangan ng reseta. And yung mga gamot, yung mga prescription medications kasi have side effects. And like I mentioned before, there are contraindications and indications to certain drugs. Kaya hindi pwedeng basta-basta na lang binibigay. Okay, naka kailangan under the advice of a doctor. Kasi at least kami, nakita namin yung pasyente, alam namin kung pwede ang gamot na to para sa kanya o hindi. Like for example, yung drug na penicillin, that's an antibiotic, and there are some people who are allergic to penicillin. So paano paano pag in-advertise yon on social media na, okay, pag inuubo ka or pag may nararamdaman kang kate-kate, i-take mo ang penicillin. Tapos hindi siya prescription medication, no? Pwede mo na lang siyang kunin. Tapos biglang adverse reaction yung pasyente. Di kawawa yung pasyente. That's why prescription medication should only be under the advice of a doctor. Hindi siya pwedeng i-advise talaga hindi siya pwedeng i-promote on social media like yung amoxicillin, yung mga ganun na gamot, cefuroxime, alprazolam. It's not something that is advertised kasi it's something na yung mga gamot na to, kailangan na interview ka muna ng doktor. Kailangan na diagnose ka muna ng doktor bago maibigay yung mga gamot na to. Yung mga over-the-counter medications kasi na ginagamot, yung mga over-the-counter medications na ina-advertise on television are for symptomatic treatment. So yung mga gamot na to, they address your symptoms. So for example, again, yung magandang example is yung fever. Give paracetamol, di ba, to bring down the fever. And pampalabas ng plema, you give N-acetylcysteine, yung mga ganun, mucolytic, expectorant, yung mga to, they're for symptomatic treatment. Okay? Kaya pwede siyang over-the-counter. Pwede siyang i-advertise, yung mga over-the-counter. Sa internet, mga herbal medicine ang palaging ipinapakita ni Google at mga lifestyle modification. Okay ba ito para sa may diabetes and alta presyon? Okay, when it comes to diseases like this, yung mga chronic diseases, diabetes and hypertension, medications given by your doctor plus lifestyle modifications go hand in hand. Okay? Pero important yung medication na binigay ng doctor mo because this is the one that will control really your blood pressure levels. But of course, we cannot rely on medication alone. We have to supplement it with lifestyle modifications. Kasi, nagagamot ka nga, pero sedentary ang lifestyle mo. Hindi ka gumagalaw, kulang ka ng physical activity, and at the same time, sobrang alat na mga kinakain mo. So, it's almost as if binibigyan mo ng burden yung gamot to do its job. Parang hindi niya na nagagawa yung trabaho niya ng maayos kasi yung lifestyle mo naman, sinisira yon, di ba? Kaya you have to do both. When it comes to herbal medications, no? I don't know why sinasuggest yun ni Google. Again, hindi nga kasi kayo nakikita ni Google. Hindi naman kasi, I mean, Google is, ano ba siya? It's a platform of different forms of information, and hindi lahat naman ng information doon is nafi-filter and they give false promises din. So, to take care of your health, it's better na nakausap mo yung doctor, 'di ba? Kasi we studied the disease, we studied the medications, we know what is safe for you, we know what is not safe for you, we know when to stop the medication, we know when to change it, we know when to adjust the dose. Itong si Google hindi naman niya alam eh. Parang sige, bigay na natin lahat ng pwedeng ibigay diyan. Wala namang kaming pakialam sa Google does not have emotions. Yun lang yung sinasabi ko sa inyo ha. Walang sympathy, walang empathy si Google or si social media. Kaya lahat na lang ibibigay niya sa'yo kahit na false yung information. Pero kami, our license is on the line. Kaya we make sure na tama yung binibigay naming gamot. And we avoid herbal medications kasi it comes with complications talaga. So don't wait na nagdadialysis ka bago mo sabihin na, sana hindi na lang ako nag-herbal. Di ba? Okay. The next question. Bilang isang tunay na doktor, masasabi mo bang mas reliable po kayo sa mga impormasyon na nakakalap namin sa internet? Okay. It depends naman kung anong information yung hinahanap nyo, di ba? So if it's medical, of course, the doctor would be more reliable than the internet. Tulad ng nabanggit ko kanina, it's because we have emotions and the internet does not have emotions, di ba? So, ayun. I mean, like I said a while ago, when you want to understand kung ano yung sakit mo, kung gusto mong makakita ng video presentation kung ano bang nangyayari sa ugat mo or sa dugo mo pag may high blood ka, go. You deserve that information. You deserve to understand that. And if gusto mo rin maintindihan kung ano ba ang insulin, ano ba ang pancreas, paano bang connection nito sa diabetes, if you want to know that information, yes, that's okay. Pero when it comes to information na managing yourself, medyo delikado yon kasi you'll never know what information is right for you, and you'll never know if that information is qualified talaga and legitimate, because there will be information there that will give you empty false promises just so you can buy their product. And kami talaga, as doctors, no, as real doctors, we make sure naman na may improvement kayo. That's why we ask for follow-ups, di ba? Kaya kami mag-follow up ka after 3 months, after a month, after 2 weeks. Kasi gusto talaga namin makita kung nag-e-effect yung gamot. Again, balik tayo kay Google. Si Google, na-follow up niya ba kayo? Si Google, alam niya ba na yung BP nyo na 150/90 naging 120/80 after 2 weeks? Alam ba ni Google yon? Hindi. Alam ba ni Google na yung sugar mo, after mo tinake yung gamot na to, hindi naman bumaba yung sugar mo dahil ang sinadjust ni Google is herbal medication? Hindi, di ba? Hindi kayo na-follow up ni Google. Wala siyang pakialam sa inyo. Kami may pakialam kami sa inyo. Walang char yun. Alright, next question. Hi po, Doc. Pag-greet birthday, Jo po ngayon. God bless. Ay, birthday ko po ngayon. Nagano pala yun. Hi, Maria Tere Castillo! Happy, happy birthday! Mayroon bang support group sa internet ang pwedeng salihan upang mas makakuha ng accurate na information tungkol sa diabetes and hypertension? Oh, support group. I'm not so sure. I'm not so sure. Although, sa barangay health centers, meron yung hypertension club or diabetes club. So yun yung, I don't know, tanungin nyo sa barangay health centers ninyo or dun sa barangay ninyo na kung meron bang hypertension or diabetes club. So every week kasi, may sineset ang mga family community doctors na lectures for patients with diabetes and high blood, so that you can adjust your lifestyle, adjust your diet accordingly para mag-improve yung sugar mo and yung blood pressure mo. And also yung diabetes club, hypertension club na to, I think it happens every month, every week. I don't know. It depends on your health center. And also nagbibigay din ang mga health centers ng free um, high blood medications and diabetes medications. Kaya yun, you try to contact your barangay health centers and see. Yun, tanungin nyo, meron po bang diabetes club or hypertension club dito? So dun magtitipon-tipon lahat ng may sakit na yun so that you get together and you learn from the healthcare worker. So at least doon may healthcare worker na guide kayo doon sa hypertension club compared to a support group. Like, hindi naman pwede na kayo-kayo lang as patients yung nagdi-discuss kung ano ang dapat inumin, ano ang dapat iwasan na pagkain. At least doon sa Hypertension Diabetes Club, may guidance from a healthcare worker. Okay. So, next question. It's the same question. Yes, what's up, Kilikilis? Panood nyo ba yung TikTok Awards, char? May pagkakataon ba sa inyong practice na mas lumala ang patients mo na may karamdaman kagaya ng diabetes and hypertension dahil mas nauna nilang sundin si Dr. Google o kahit si Dr. Kapitbahay? Yes, may mga patients who get worse because they chose to go for the alternative route. Actually, hindi naman nila inuna si Google. Inuna talaga nila yung doctor. They went to the doctor first. Pero, nung nalaman nila na ganito yung price ng gamot, mahal siya, and they don't know where to access affordable medicine, ayun, naghanap na lang sila ng iba. And pagtatanungin mo, bakit po kayo nag-herbal? Bakit itong gamot yung ininom nyo, hindi yung unang nireseta ng doktor? Kasi mahal po, kaya ito na lang. And ayun, they developed kidney problems, nag-kidney failure, nag-liver failure, and some of them, to a certain extent, nag-dialysis, like I mentioned a while ago. And ayun, it almost as if it sounds like medication is for the privileged. Pero no, it's not. Healthcare is for everyone. It's not for the rich. Hindi lang para sa may kaya yan. Kasi the government hospitals, mga government clinics, they do offer discounted medications or even free medications kung kailangan talaga. There is, you just have to ask your barangay health centers, ask your government OPD clinics. Meron yan. Meron yung mga nag-offer talaga ng affordable medication, free medications even, and quality pa rin yung mga gamot na to. They still give the same effect. Same pa rin yung active ingredient na ibibigay nila. Hindi naman siya parang pucho-puchong gamot kaya siya mura. Hindi. It's still the medication that will be effective for your disease. Sa tumatagal na pandemic lockdown, kasabay ng takot sa pagpunta sa clinics o hospitals, anong suggestion mo, Doc, upang hindi umasa ang tao sa pagse-self-medicate? Well, prevention is better than cure. O, di ba? Napaka-cliche, and it's something that I keep paulit-ulit ko talagang sinasabi with any guesting that I have, any videos that I have. That's the reason why I make my videos, is so that you're knowledgeable about different diseases, and at the same time matuto kayong iwasan ang mga sakit na 'to. Kasi if you know how to take care of yourself the right way and you avoid these certain illnesses, you will avoid the expenses that come with it. So yun talaga yun. Prevention is better than cure. So pero paano pag na-diagnose ka na with hypertension and diabetes? Well, never self-medicate talaga. Isipin nyo na lang na I should trust someone na alam kung ano ang epekto ng gamot sa katawan ko, na kilalang kilala ang sakit ko, and that's why we are professionals, no? We guide you as much as we can, and we make sure naman na optimal yung treatment nyo. And when you self-medicate kasi, you don't know if this is the right treatment for you. Kasi 'di ba, I mean, not to say na doctors lang may alam ng lahat. Of course, doctors don't know everything. But when it comes to your health, we try to know everything about your health so that we give the best treatment for you. Siyempre, hindi naman kami magaling mag-bake. Lahat ba ng doctors magaling mag-bake? Hindi naman namin pinag-aralan yan. Pero pinag-aralan namin yung sakit nyo and yung mga gamot. Kaya, don't trust Google. Don't trust your kapitbahay. Trust in your doctor. Sa diet or exercise, masasabi mo bang acceptable ito kumpara sa mga gamot o any alternative medications on the internet? Okay, so it depends kung ano yung sakit mo. Now, for example, if you're pre-diabetic and you're pre-hypertensive, yes, diet and exercise are excellent alternatives to control your blood pressure and to control your sugar. That way, you prevent yourself from going into full-blown diabetes or full-blown hypertension. Yes naman, meron naman talaga yung mga sakit na nakukuha sa diet and exercise lang. Like for example, pag mataas yung cholesterol mo and you're young and you're very active, you don't need to rely on medications pag mataas ang cholesterol mo. Kung kaya mong bawiin yan sa diet and exercise, yes, pwedeng pwede. There is such a thing called lifestyle medicine wherein ang focus talaga doon is lifestyle changes to manage your disease. Pero sometimes talaga lifestyle changes are not enough for some diseases. Pag malala na talaga yung sakit mo, pag nasa hypertensive stage ka na talaga, lampas ka na sa pre-hypertensive, full-blown diabetic ka na, lampas ka na sa pre-diabetes, you really have to incorporate medications into your lifestyle kasi yun ang nasa guidelines. Yun yung proven to help control sugar and help control your blood pressure. So yes, if you're pre-diabetic, pre-hypertensive, pwede pa yung habulin ng diet and exercise lang without medications at all. Tungkol naman po sa mga testimony on the internet na gumagaling sila lalo na sa diabetes or hypertension at napaka-epektibo ng gamot o proseso ng paggagamot, reliable din ba itong paniwalaan lalo na kung may mga doctor na endorsers or nag-comment nito? Okay, that's interesting. Well, it depends on what medication that is, Pero like I said, yung mga like I said, the management for each patient is different. Okay? Just because nag-work yung management ng patient na yun for her, it doesn't mean na mag-work naman yun for you. So yung mga testimonies na to, ano ba yung history ng patient na yun, 'di ba? May comorbidities ba siya? May other diseases ba siya? Or baka naman hypertensive ba talaga siya? Or baka pre-hypertensive lang kaya nagwo-work tong ina-advertise nilang gamot. 'Di ba? May mga no, 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 no. Kahit na may mga testimonies from healthcare workers about this medication that it is effective for diabetes or hypertension, it's still best to consult your doctor, no? And I know sasabihin sana all may pampakonsulta. Ang consultation with a doctor ngayon and telemedicine, some of them are cheaper than the products in Lazada or Shopee. Dapat marunong lang kayo maghanap. Meron yung mga Meron pa nga mga free teleconsultation services eh. And even in government hospitals, yung mga barangay health clinics, free yung mga consultations doon. So go to your barangay health clinics. They offer free health consultations. Okay, and isipin mo na lang, kung kaya mong mag-add to cart and check out, kaya mo rin mag-sacrifice ng konting money for your health. You know, it's good to invest in health because if you invest in your health, you prevent further expenses for your health. No, so gastos ka lang ng konti for consultation para at least alam mo kung nasan ang status ng health mo and mabigyan ka ng proper advice para maiwasan ang chronic diseases. So trust your doctor. Okay. Wow, maganda tong question na to. Very creative. Okay lang ba maglagay ng rubbing alcohol sa underwear? Hindi ba masama 'yun? All right. So hindi ko alam kung bakit sino ba ang gagawa nito. Siguro babae siguro ang gagawa niyan. I don't think men would like to do that. Na siguro para mawala yung mabaho na odor sa genitals kaya siguro ginagawa nila yung rubbing alcohol thing. But that is not advisable, okay? Because it can damage yung lining ng mucosa ng ari ng babae and it can lead to more infection. So if you don't already know, ang ari ng babae ay may self-cleaning mechanism. So you don't need alcohol in your underwear. Just wash the outside of your genitals properly. Wag na sa loob, just the outside with soap and water. That's enough. Hindi na kailangan ng rubbing alcohol sa underwear. If may malansang amoy na nakaka-bother na hindi talaga matanggal-tanggal kahit anong gawin mo, magpa-check up ka na kasi baka may ongoing infection ka na. All right. So thank you so much for all your questions. For other additional information about diabetes or hypertension, do visit Sugar Beat PH on Facebook, Instagram, and YouTube. Ayan, may mga ibang lectures pa from other doctors weekly about diabetes and hypertension. So here, actually, sa mga naghahanap ng support group, to know the right information about diabetes and hypertension, Sugar Beat PH is the perfect platform for you to visit kasi lahat doon are all qualified, legitimate information given by doctors. Kaya yan, Sugar Beat, yan yung magandang place ninyo to seek the right information. Ayan, once again, thank you so much. This is Dr. Kiliman Guru. I hope madami kayong natutunan kahit na medyo paulit-ulit na lang yung sinasabi ko because some of the questions are connected to each other. Kaya I don't know how to say it differently. Ayan. Are there other questions? May mga pahabol ba? Charot.
Thank you to our guest speaker for providing with us another informative virtual session here in Sugar Beat. For more information like this, please like, follow, and subscribe to Sugar Beat PH social media platforms. You can find us on Facebook, Instagram, and YouTube. Do you have a question about diabetes and hypertension? Our chatbot is ready and at your service. Please send us a message on our Facebook page Messenger and we'll try our best to give you the answers. Once again, thank you for joining, and see you again on our next program.